Welcome back and thanks for staying with us. The World Health Organization has launched its 2026 Global Health Appeal, highlighting urgent health needs in humanitarian crisis worldwide. Last year, WHO supported 30 million people through life-saving vaccines, health services and mobile clinics. Now it's seeking nearly $1 billion to respond to 36 emergencies. To explain what this means, we're joined online by Dr. RABINDRA ABEYASINGHE, who joins us all the way from Cyberjaya. He's the WHO representative to Malaysia, Brunei, Darussalam and Singapore. Dr. RABINDRA, thank you so much for doing this and for taking time off for Bernama TV. Now, WHO is asking for nearly $1 billion in 2026, and this is to deal with 36 emergencies, and 14 of those are what you call grade 3 crisis. Now, the most serious level, or at least that's what we know, for viewers or the viewer who may not know what actually makes something a grade 3 emergency, how does WHO decide a situation is severe enough for that top level response? Dr. RABINDRA?
Thank you so much for having me and for initiating a discussion on this very important topic for WHO and I think for the global community on a whole. So this appeal does not relate to WHO's routine work, but it relates to a component of its routine work where we help communities and people affected by humanitarian crises, conflicts, and emergencies. So this appeal is specifically to help those people affected by such situations, and we are particularly worried about 36 conflicts and situations, humanitarian crises that are occurring in the world. Our support entails providing health services for the people in those conflict situations, and it's captured under the international health regulations, but also as the health lead for international support during humanitarian crises. What we mean by a grade 3 emergency is, so WHO has country officers, regional officers, and its headquarters. And a grade 3 emergency would mean that the country office alone or the country office and the regional office cannot support. The resources of the entire organization across all 3 levels need to be mobilized to respond to this particular situation that is happening in a country. And that is why we've graded 14 of those current conflicts as requiring resources across the organization.
Now, when we look at your 2026 priority emergency areas, which countries are we talking about exactly? And help us understand this. What has to happen on the ground for a country to be put on that priority list?
So that depends on how bad the humanitarian crisis situation is, how bad the evolving situation is, how badly disrupted the health access of the population is. I could highlight the countries that we are going to be targeting at this point of time in the year. Of course, this changes daily based on which kind of conflicts or crises are emerging. The countries I'm listing are not in any order of priority, but in alphabetical order. So Afghanistan, the Democratic Republic of the Congo, Haiti, Myanmar, the occupied Palestinian territories, Somalia, South Sudan, Sudan, the Syrian Arab Republic, Ukraine, and Yemen would be the primary countries. But we are also conscious that there are countries being affected by large-scale cholera outbreaks and mpox outbreaks, which require urgent assistance.
Now, looking at the numbers in front of me, WHO and its partners reached roughly 30 million people last year. We're told that it includes millions of vaccinations and over 1,000 mobile clinics. Now, from your perspective, which of these really had the strongest impact, and what lessons carry into this year's plans?
So, Gerard, each of these has a massive impact on the recipients, the individuals who are affected, right? Whether they are kids who receive their vaccines and are protected from vaccine-preventable disease outbreaks, whether they are adults who are requiring their routine treatments, whether they are people who are traumatized or injured due to conflict, who require first aid and surgery or post-traumatic care, whether there are populations that require mental health support because of an emerging, expanding crisis situation. For each of those individuals, the support we provide is absolutely essential and is the best thing that can happen for them. The problem is that the need is so huge, and without predictable funding, it's difficult for the organization to target and plan. So if you see, we have not been able to respond to every humanitarian crisis because we are constrained by the lack of resources. And that's why this appeal is very timely, is very important, and we are reaching out to as many people, persons, governments who can contribute to this appeal. That does not mean that the appeal is time limited, because as situations evolve, people can always contribute. We do additional calls, but it's important for us to have some degree of predictability of what is the operating budget we can have based on the scale of the conflicts that are currently ongoing. Thank you.
Right, right. Now, you've said global humanitarian funding is now even lower than it was almost, let's just say, a decade ago. Practically speaking, what does that shortfall mean for your day-to-day operations, and what dangers does it create for people already living in crisis zones?
So we are operating in a global financially constrained environment, and our operating systems are constrained by that, particularly with the recent US withdrawal, but also a reduction of contributions to humanitarian needs and health needs globally because of what's happening on the geopolitical front. But this is not about our routine operations. This is about one aspect of our routine operations, which is helping health emergencies and humanitarian crises. And that is why this appeal is particularly important.
Now, if you look at it right now, crisis or big problems don't come one at a time. You have conflicts, climate shocks, and of course maybe sometimes disease outbreaks all happening together. Now, how does that combination change the way WHO plans and responds? Does it make emergencies more complex than before, handling it now versus before? Give us some context here, please.
So we do our routine operations. So we are helping the improvement of health systems in countries, including in countries that are not affected by conflicts, like you have in Malaysia here. But then we also have the response to the crisis and the emergencies and the disease outbreaks. And so across all our activities, we have to work with limited resources. You are probably aware that we've had to reduce our human resources footprint also because of resource constraints. That means that our ability to respond is constrained, is limited in time, and is limited in scale because we need more resources to be able to respond to the number and severity of crises that are taking place.
Right. I'd like to interject here because we're running out of time, and I have one very important question for you. In the next minute or so, this appeal really depends on global support. If you could speak directly to governments, donors, and even ordinary people watching, what would you say to convince them that acting now truly matters?
Well, this is about providing services to people. It's about helping people protect their dignity in the face of this crisis or humanitarian situation that they are facing, in the face of an outbreak they're facing. So it is particularly important. It is, as our DG said, it's important not only for them, for the people to continue to receive the services, but it's also morally important so that we give them a strong signal that we as the global community have not forgotten them in their time of difficulty, in their time of conflict. So our appeal to anybody hearing this is, please consider this not just a charitable cause, but it's something that is important for our global community.
Something that is truly important for humanity and the global community. Dr. ABEYASINGHE, WHO representative to Malaysia, Brunei, Darussalam and Singapore, joining us on WHO's Global Health Appeal. For more on this, go to Bernama.com. More global updates in just a bit. This is The World on Bernama TV. Stay with us.